Despite all the evidence, exercise medicine is not offered to all cancer patients as standard care. Despite overwhelming evidence from the last 30 years that the outcomes for the patient will be better, that their quality of life, which is the main thing, will actually be better. Symptom experience will be reduced. Side effects of treatment will be much lower if the patient is physically active or gets physically active. The problem is that it hasn't been adopted broadly, and most patients have no access. They can't access exercise oncology services. Government doesn't really support it. Health insurance doesn't support it. You can't provide a service without funding. It's, you have to pay the staff that are delivering the exercise oncology. They have to eat like anyone else. They have to feed their kids and put them through school. So you can't have a quality service that's free. Someone has to pay for it. But for some reason, there's just not the desire through government, health insurance, hospitals, cancer centres. There just is not sufficient motivation for them to implement broadly high quality exercise oncology services. And so I think a part of this is people think, oh, it's just physical activity. It shouldn't cost anything. Just tell them to walk. Why should you have to pay for, exercise? It's free. And don't get me wrong, any physical activity is going to be beneficial for the patient. The worst thing they can do is be sedentary, and that really compromise their capacity to overcome the disease and survive. But I think we could do a lot better than that. Particularly patients who have advanced disease or have very aggressive disease, patients who are going through treatment and experiencing quite impactful toxicities or side effects of treatment. We have to do better than just tell them to go out and walk or join a gym. That doesn't work. It just doesn't work. They won't, or they can't do it. And so we have to be much more sophisticated than that. And that's why we've been really looking, well, how else can we motivate patients and clinicians and government and insurance companies to actually support exercise as a medicine rather than just generic physical activity guidelines?